Generally speaking, we define temperature dysregulation as the brain's inability to correctly control and regulate the body's temperature. It can't keep it stable. This is observed in the disruption of normal difference between the inside body temperature and the outside body temperature, or the core temperature versus the shell temperature. In scientific terms, we call this proximal versus distal temperature. Obviously, these two temperatures aren't the same on anyone. The tip of our nose isn't going to be the same temperature as our stomach, but there's a normal, established, known differential between these two temperatures. And when it's out of whack, that tells us that the body isn't releasing the heat that it generates properly. And this inability to release built-up heat, this inability to regulate body temperature in FOH patients, results in all sorts of different symptoms that have been viewed as psychiatric or behavioral. But for now, I'm still going to focus a little bit longer on explaining what this temperature dysregulation looks like, because once you know what to look for, it isn't actually that hard to spot. In fact, most of the signs of it are like right in front of a person's face. They just don't notice them or connect them to mental health or mental illness because they've never been taught to associate the two before. So there are specific scientific methods that researchers use, and the researchers who first identified FOH and continue to study it, that they use to document temperature dysregulation. And this includes taking temperatures on multiple parts of the body at multiple different times of day, using a special thermometer over the course of several weeks to months, and graphing it, and et cetera, et cetera. This brings scientific validity to the diagnostic process, but frankly, this is totally unnecessary most of the time because the indicators of temperature dysregulation are abundantly clear once you know what to look for. So for diagnosing a thermoregulatory problem in kids, or teens, or adults, we can simply look for the presence of two or more of the following criteria. They feel excessively warm or hot at bedtime and overheat during the night. They feel cold in the morning after having felt hot at bedtime. They feel excessively warm during the day in neutral temperatures. They show moderate to extreme tolerance to the cold. And they overheat or sweat profusely with minimal exertion. Or temperature dysregulation. Oops, I'm on the wrong slide. Apologies. Temperature dysregulation is most often described by parents in shorthand as just overheating. And while it's more complex than that on a scientific level, it is a useful shorthand descriptor because these overheating symptoms occur during the day as well as during the night and during sleep. So we're going to look at these three different cases. The physical signs of overheating include sweating a lot during regular exercise. Now, during exercise, you're supposed to sweat, but there's a difference between an expected amount of sweat and really sweating excessively or profusely. There's also sweating when it's not particularly hot out. You're in what appears to be a neutral ambient temperature, and nobody else is overheating or sweating, but the person with this temperature dysregulation issue is. The next sign is a flushed face, warmer than usual skin, Sometimes parents describe children who have this dysregulation as being like a little radiator, and they can put their hands next to the child's face, forehead, back, or chest and feel heat radiating off them. Also, a telltale sign of thermodysregulation is bright red ears that are actually red, warm, and can be actually hot to the touch. In addition to these signs of overheating, during the day, parents and family members of people who have this temperature dysregulation issue also notice that the individual has a tolerance to the cold and is comfortable outdoors in icy temperatures without wearing weather appropriate clothes. In fact, many parents report that they have arguments with their kids because the children won't agree to wear weather appropriate clothes like coats, jackets, sweaters, sweatshirts, or even long sleeves or long pants most of the time, including in the dead of winter. Kids with temperature dysregulation issues want to wear summer clothes all year long, like shorts and t-shirts and sandals outside in freezing temperatures. Many parents report that trying to get their child to put a coat on in the winter to wait outside for the bus can turn into a knockdown, drag out fight. But when you understand temperature dysregulation, we can understand why they're doing this. Wearing a coat makes them feel hot, and their body can't cool them down effectively. So they never acclimate to wearing the coat in the way those of us who can thermoregulate do. And this dysfunction winds up leading to other symptoms. Sometimes the person with temperature dysregulation will refuse to wear really clothes at all most of the time when it's socially appropriate. Often kids will strip off their clothes the second they get home, or when they get into the car after school in the afternoon, and they'll spend most of the time that they're at home sitting around in just their underwear. They may refuse to put on any clothes, socks, or shoes until the last possible second before leaving the house. Parents and other family members often see this as difficult or oppositional behavior because the person isn't completing the task that's been asked of them, which seems on the surface to be very simple. Just get dressed. But this dislike of clothing makes sense when you consider that thermodysregulation causes the body and the skin not to release built up heat properly. So when you start off with that problem and then you add layers of clothing that trap that heat next to the skin, you can see why that might be intolerable. And now that you understand why wearing clothes feels so terrible, it is, I think, pretty easy to realize that they're not putting it on intentionally to be oppositional or defiant. Another aspect of the cold tolerance is difficulty actually sensing what temperature it is outside, because these folks literally don't feel cold. This has its own negative consequences because even though they don't feel cold, their body is registering that it's cold outside, and the body then starts to generate heat to keep itself warm. And the problem is that once the body turns on that furnace, it likely won't recognize when they go back inside that it's time to turn off the furnace, which means that it's just chugging along, running, creating heat all of the time, making the person warmer and warmer throughout the day until all of that undissipated heat becomes overwhelming in the late afternoon and early evening. This leads to issues of overheating that last into nighttime, which starts with feeling excessively warm or hot at bedtime, leads to overheating during sleep, and culminates with feeling cold in the early morning. At bedtime, they may feel so hot that they can't get into bed, get comfortable, or settle down. And sometimes they won't even put on their pajamas. In both of these cases, parents are inclined to see this behavior as oppositional or uncooperative or avoidant, when in fact, it's really just the result of built up heat. During the night, overheating usually results in kicking off the bed sheets and blankets and sweating while asleep, sometimes so significantly that the bed sheets are damp or wet from the sweat. And the early morning cold, those feelings are also part of the faulty temperature regulation system, because it's the opposite of the normal temperature rhythms of the human body, which calls for cooling off of the body in the evening to prepare for sleep and warming up of the body in the morning, to prepare for waking. You can tell that this is happening because those with a temperature regulation problem have a very difficult time waking up in the morning, and they want to stay in bed bundled up in blankets. Again, parents have a tendency to see this as difficult or oppositional behavior, the kid refusing to get out of bed. The truth is, because their body temperature is staying so low and not warming up, their brains are having a very significant difficulty waking. So it's not just a refusal, it's a biological need to stay asleep.